Common causes of low back pain. There are many different causes for low back pain. The most common causes are mechanical in nature. This means that there's a disruption to the normal functioning of the anatomical components of the low back. I will now present a list that includes some of the most common mechanical causes of low back pain, as well as some of the non-mechanical causes. Bones, muscles and joints. Muscle strain. When a muscle is stretched beyond its normal limits, this can sometimes cause a muscle to tear, damaging the muscle. A muscle strain is usually a result of overuse, fatigue, or improper use of the muscle. It can happen suddenly, or it can develop slowly over time. Ligament sprains. Ligaments are strong supportive tissues that are located around joints. They act as a supportive structure around a joint that aid in improving stability of the joint. A sprain occurs when the ligament is overstretched. Sometimes tearing can occur. This is known as a ligament rupture. Facet joint dysfunction. The spinal column is made up of 33 spinal vertebrae that are connected together by facet joints. The joints have cartilage between the bones and are supported by an abundance of ligaments, including a capsular ligament. Within the capsular ligament, there is fluid known as synovial fluid, which aids in the smooth moving of the joint. The capsule, ligaments and joints are highly innervated. Through injury, trauma, poor posture and many other reasons, these joints can be affected and cause pain, on their own or in conjunction with the other intervertebral discs. Spondylolisthesis. This is where one of the vertebrae in the low back moves out of its usual normal position, usually slipping forwards. This causes instability within the spine. If the bone slips too much, it may compress onto the surrounding nerves, causing pain and neurological symptoms down the leg. Sacroiliac joint dysfunction. The sacroiliac joint is located at the base of the spine, where the spine meets each side of the pelvis. It is a very strong joint that absorbs a lot of force created from the upper and lower body. The SIJ doesn't have much range of motion and can become painful if there's too much motion or too little motion. It can also become painful if it becomes inflamed. This is known as sacroiliitis. Changes associated with age. Spondylosis is another term to describe osteoarthritis of the spine. It is the age-related changes that occur to the spinal column, including the discs and facet joint. As these changes occur, they can cause pain, inflammation and instability within the joint. In some cases, it can cause a narrowing of the spinal canal. This is called stenosis. Degenerative disc disease. This is an age-related condition in which one or more of the intervertebral discs within the spinal column lose their ability to act as a cushioning for the spine. As a consequence, they become weaker and develop tears. In some cases, it can also cause the spinal canal to narrow. This again is referred to as stenosis. Osteoporosis. This is a condition in which there is a weakening of the bones due to a reduction in bone density. There is greater prevalence in the elderly, but can also come as a result of some endocrine and metabolic diseases. Due to the reduction in bone density, compression fractures are common, which can sometimes cause pain. However, pain is more likely to be caused due to there being compression onto the neurological structures as a result of the compression fracture. Nerve and spinal cord problems. Lumbar herniated disc. Intervertebral discs act as a cushion, aiding in holding the spinal vertebrae together. The discs help prevent the vertebrae from rubbing together and consist of a gel-filled inner layer surrounded by a hard fibrous outer layer. Sometimes a person can injure or strain their discs, causing part of the gel-filled nucleus to herniate out of the fibrous outer casing. This is known as a herniated disc, prolapse disc or slip disc. When the disc herniation occurs in the low back, it may compress onto the sciatic nerve, causing symptoms into the buttock, thigh, leg, and/or foot. Spinal stenosis. This is a condition in which there's a narrowing of the spinal canal. There are many different causes of spinal stenosis, such as injury, trauma, and degenerative changes. Less common causes of low back pain. Infection. Spinal infection is very rare, but can cause severe pain and be life-threatening if left untreated. Also known as osteomyelitis, it can be caused by bacteria in the bloodstream, infectious disease that spreads to the bone, infection from recent surgery, or injection in or around the bone. Tumours. Tumours in the spine are not very common. However, if they do appear, they usually start elsewhere in the body and metastasize to the spine. The most common tumours that metastasize to the spine start from cancers in the prostate, kidney, lung, breast, and thyroid. Autoimmune diseases. Back pain is a common symptom in individuals suffering from autoimmune diseases such as ankylosing spondylitis, rheumatoid arthritis, lupus, and Crohn's disease.